Hello everyone, welcome back to my channel. Today's topic is water and electrolyte. This topic is learned by BSc Nursing, first year in nutrition, similarly second year in medical and surgical nursing. The content of this topic for both the year remains similar. Difference is this will be asked in different pattern of way for both years. Overall, it is beneficial for both BSc first year and BSc second year. Let's get started with the video. First of all, introduction of water. Our body is composed of 70% of water. That's why our weight is the weight of fluid contained in our body. The fluid is contained in extracellular and intracellular space. Within the intracellular and extracellular space, water is found in intravascular, interstitial, transcellular, and intracellular compartment. Also, extracellular fluid contains sodium and chloride, whereas intracellular contains potassium. Both the parts contain both the electrolytes, but mainly the chief electrolyte found in both parts has been explained in this little paragraph. In distribution of body water, it varies according to age. It is different in infant, different in other age group children, and different in adult. For adult of younger adult, middle adult, and old age adult, the percentage remains almost the same. Just a slight difference is during old age, body fluid becomes slightly lower than the young adulthood. Percentage of water in human body in the body of fetus is 100% because it is totally dependent upon the mother's body and it is just growing as a human. In infant 80%, adult 70%, and elderly 50%. Water is quite very important for the human body, but to sum up the importance, it transports nutrients to every cell, it facilitates cellular metabolism, it acts as a solvent for electrolytes and non-electrolytes, it helps to maintain normal body temperature. In regulation of water metabolism, the total water level within 24 hours in our body can be at least 2500 ml. What happens is intake and output continuously. We continuously take water and throw out water through different medium of the body, but 2500 ml should remain constant in the body. Intake through metabolism 10%, food 30%, and beverages 60%. Similarly, output through feces, sweat, skin, and urine. Percentage is 4%, 8%, 28%, and 60%. Introduction of electrolytes. They are the substances whose molecules dissociate, divide into ions when they are placed into water. That means they travel in the body through water. There are two types of electrolytes that are cations and anions. The ions which are positively charged are cations and negatively charged are anions. This is the composition of electrolyte in the body. Sodium, potassium, calcium, magnesium, and chloride, bicarbonate, biphosphate, sulfate, and protein and organic acid at the last. Functions of electrolytes are to promote neuromuscular irritability. Neuromuscular irritability is a healthy irritability. It is a movement that carries on our neuromuscular activity, connection between muscles and nerves. To regulate acid-base balance, to regulate distribution of body fluids among body fluid compartments. Fluid and electrolyte is balanced through many organs. The first is kidney because it plays the main role. There are hormones that helps to regulate fluid and electrolyte balance. Those hormones are aldosterone, first, sodium and water retention, antidiuretic hormone. It performs water retention from tubules. Renin-angiotensin, it performs sodium and water retention. Atrial natriuretic peptide, it increases urinary excretion of sodium. These hormones are regulated by various glands of the body, like hypothalamic gland, which stimulates the thirst and also helps in ADH release. Pituitary gland releases ADH. Adrenal cortex releases aldosterone and also responsible for sodium and water retention. There is a natural mechanism in our body which is called as thirst. Thirst is activated when our body feels there is a lack of fluid inside the body. Thirst tells us that there is some need of water in the body. Whenever we feel thirsty, we should take a subtle amount of water. This is the mechanism of thirst. There is decreased fluid volume due to many causes, disease condition, dehydration, long interval between the last water intake. It increases the plasma osmolality, that is increased chemical particles at the fluidy part of the body. After that, the hypothalamic center of thirst is stimulated and antidiuretic hormone is secreted. After the secretion of antidiuretic hormone, there is an urge to take water and we orally take the water. There is a condition called overhydration. This is initiated when we take more than normal level of water. It is also caused due to disbalance of fluid. When electrolyte in the body becomes too much dilated in the solvent, then kidney cannot excrete normal amount of urine. That is where overhydration occurs, because the excess fluid in the body is always excreted by urine. When kidney is not able to pass out urine, then those fluids remain inside the body. Overhydration. It can occur in conditions like cardiac failure, liver cirrhosis, uncontrolled diabetes. Symptoms can be edema in lower extremity, puffed face, increased heart rate. There is a dehydration opposite to overhydration. When there is lack of enough intake of water in the body, dehydration occurs. The most common cause of dehydration can be diarrhea and vomiting, because our body loses fluid and electrolyte through diarrhea and vomiting. Symptoms can be dry mouth and tongue, sunken eyes and cheeks, irritability, confusion, extreme thirst, and dark colored urine. Water intoxication can be the next condition. It occurs when there is excess oral water intake that disrupts in the brain functioning. Kidney can eliminate 20 to 28 liters per day. More than that is intolerable by the kidney. Kidney filters. But when there is water intoxication or too much high level of water, then kidney is unable to perform its natural function. Excess water intake does not occur accidentally, but it might occur in some conditions like vigorous exercise, mental health condition. Symptoms of water intoxication can be headache, nausea, vomiting, drowsiness, muscle cramping, and diplopia, double vision. Electrolyte imbalances that can occur in the body is due to sodium excess deficit, potassium excess or deficit, and calcium excess or deficit. Hyponatremia, hypernatremia. For potassium, it is hypokalemia, hyperkalemia. For calcium, it is hypocalcemia and hypercalcemia. Hyponatremia is a condition that occurs due to loss of sodium containing fluids in the body. Causes of hyponatremia can be diarrhea, vomiting, angitube suction, renal loss, or burn. Symptoms in hyponatremia can be dizziness, fatigue, lethargy, and oliguria. Medical management. Hyponatremia can be medically managed through sodium replacement or IV ringer lactate. Hypernatremia, when the sodium level rises more than 145 m equivalent per liter. Causes can be hypervolemia, inadequate water intake, increased serum sodium. Symptoms can be dehydration, thirst, irritability, or altered consciousness. Medically, hypernatremia can be managed by lowering the sodium level by the infusion of hypotonic solution, that is 0.3% NaCl, and administration of diuretics that promotes excretion of urine. Hypokalemia can be a condition when there is loss of excess potassium from the body. Potassium loss can be due to disease condition, due to lack of potassium intake, such causes. Symptoms can be constipation, fatigue, muscle spasm, tingling, or numbness. Symptoms of hypokalemia can be constipation, fatigue, muscle spasm, tingling or numbness of the muscles. Medically, hypokalemia can be managed by supplying potassium supplements to the patient like IV or oral potassium, administration of 40 to 80 m equivalent potassium per day. Next condition is hyperkalemia, when there is excess potassium in the body. This can be due to excess oral intake of potassium source or through any drugs, or excess shift of potassium out of the cell. This occurs in disease conditions like acidosis, crush injury, fever, or failure to eliminate the potassium, renal disease, or adrenal hormone insufficiency. Medically, hyperkalemia can be managed by performing immediate ECG. ECG shows a mark of hyperkalemia. After that, there can be restriction of dietary potassium, IV calcium gluconate, as calcium gluconate is an antidote for a condition where there is hyperkalemia. Next condition is hypocalcemia, any condition in which there is lack of calcium in the body. This can be due to lack of parathyroid hormone. Parathyroid hormone helps in secretion of calcium. So lack of parathyroid hormone can lead to lack of production of calcium in the body. This can be due to multiple blood transfusion, chronic renal failure, chronic alcoholism, or alkalosis. Clinical features can be chopstick sign. This is twitching of facial muscles, or Trousseau's sign. This is a spasm in hand. We have a diagram. This diagram and this diagram. This is the first chopstick sign, and second diagram is for Trousseau's sign. In chopstick sign, when there is a slight stimulation, there is spasm of facial muscles. Similarly, in Trousseau's sign, there is involuntary movement of the upper extremity this way. Medically, hypocalcemia can be managed by providing IV administration of calcium gluconate, and calcium chloride can also be a good option. Vitamin D therapy can be given where at least 1000 to 1500 mg vitamin is provided per day. Next condition is hypercalcemia, where there is excess level of calcium in the body. Causes can be multiple myeloma, prolonged immobilization, prolonged bed rest, vitamin D overdose, or thiazide diuretics intake, drug containing thiazides. Symptoms can be pain in the abdomen, bones, constipation, loss of appetite, excess urination, polyuria, confusion. Medically, hypercalcemia can be managed by providing IV fluid to dilute the excess calcium present in the body, or 0.9% NS can be provided for dilution of the excess calcium present in the body. Also, IV furosemide can be provided so that excess amount of calcium can be excreted out by the urine. Calcitonin administration can be done to lower the serum calcium level. Whenever there is disbalance, lowering can be done. Thank you so much. Next topic will be discussed in next video.